I'm Dr. Elyse Love. I'm a dermatologist in New York City, and I work at Glam Derm in Gramercy Park, where we specialize in medical and cosmetic dermatology. Today, we're going to discuss hyperpigmentation. So the prefix hyper means excessive, and so hyperpigmentation just means excessive pigmentation that's more than your normal skin tone. And it can be caused by multiple different ways, but the three basic reasons for hyperpigmentation are: one, because of a primary hyperpigmentation disorder, such as melasma; two, post-inflammatory hyperpigmentation, so as the skin heals from another inflammatory condition, be it acne or as eczema or any other rash, you can get hyperpigmentation. And then three, there is hyperpigmentation that's just a result of chronic sun exposure, and this is a form of photoaging. And so people who are most at risk for hyperpigmentation are people who naturally have more pigment in their skin. And so the darker your skin tone, the more likely you're at risk of developing both post-inflammatory hyperpigmentation, sun-induced hyperpigmentation, and primary pigmentary disorders. So how do you prevent hyperpigmentation? So hyperpigmentation is a response, and so you want to prevent hyperpigmentation by actually treating the cause. For post-inflammatory hyperpigmentation, the most important thing is going to be treating the underlying inflammatory condition so that you don't continue to develop new hyperpigmented patches. For sun-induced hyperpigmentation, this is a result of chronic UV exposure over years, and so the most important thing is going to be using diligent daily sun protection, not just sun protection on high sun exposure days. And then lastly, for primary hyperpigmentation disorders such as melasma, the most important element for prevention is going to be sun protection. Today, I'm going to show you on my patient Melody how to treat hyperpigmentation with a chemical peel. So Melody has some hyperpigmentation that's left over from a recent acne outbreak, located mostly on the central forehead, but also on the cheek area. What's important to know is that post-inflammatory hyperpigmentation is different from acne scarring. Acne scarring is actual depressions in the skin, and that can be very difficult but possible to treat. Whereas post-inflammatory hyperpigmentation can be very easy to treat with a light chemical peel that takes about 5 to 10 minutes in the office. Okay, so we will start by doing what we call degreasing of the face. And so the important thing about chemical peels is that you want to make sure the face is completely clean, because if it's not clean, then the chemicals won't penetrate to the level that we want them to. So the peel we're using today is a peel called VI peel, and it's a combination peel that has TCA, so trichloroacetic acid. It also has salicylic acid, and those will both kind of help exfoliate the skin. In addition, it has vitamin C, so as we kind of expose that top layer of skin, this is going to allow the vitamin C to kind of sink a little bit deeper, which has antioxidant purposes and will help with the pigmentation. And then it has retinoic acid, which also helps with the pigmentation and helps with the acid. And then the last component is a component called phenol, which is a chemical peel that just allows it to penetrate a little bit deeper. Okay, so we just completed Melody's chemical peel. We did a peel to the entire face, and then we did some selective treatment to the areas of hyperpigmentation. As you can see, immediately post-treatment, she has very little redness and very little inflammation. I will say that starting about tomorrow, definitely by day 3, you'll start to experience some peeling. You will get significant peeling over the next 3 to 5 days, but then you'll notice that your skin tone just looks refreshed and also more even by day 7. So in the post-procedure period, it's more important than ever to make sure that you're wearing adequate sun protection. And you want to make sure that you have a sunscreen that has both a physical component that protects against the harmful hyperpigmenting effects of UV damage, but you also want to make sure that it has a tinted portion, and that's going to help protect you against the hyperpigmenting effects of visible light. Two options that I love are the Supergoop 100% mineral matte sunscreen, which is a great primer to use in the morning, and then also you can reapply every 2 hours with the powder so that you don't mess up your makeup. And so there are multiple ways that you can treat hyperpigmentation on a medical level, including topical creams, chemical peels, and lasers, but none of them will work if you're not already using diligent sun protection. Thank you for watching. If you have any questions or comments, please leave them in the comment section and we'll get back to you.